So to do the anterior dental dam with clamps, I'm gonna first examine the mouth. And when I do the dental clamps with the anterior, I am gonna go from first premolar to first premolar. So since I'm doing maxillary, that's gonna be tooth number 5 to tooth number 12, okay? So I'm gonna look at the mouth first, and he is missing his lateral again, so we're gonna not punch that hole. And since I'm going to first premolar, I don't have to worry about this space in the back. The clamp is gonna go over this premolar. So then I'm going to punch my holes. And now for the first premolar and for the canine, I'm going to use a size 3 since they're about the same size. So I'm going to go to my first premolar, punch that hole, remember, pull through the stylus. Then I'm going to go to my canine, punch that hole, pull it through. And to save myself some time, I'm just going to go ahead and go over to the other side, and I'm going to do my first premolar over here. And I'm going to do my canine. And then since I'm in the maxillary, I'm going to switch it to 2 for my incisors. And on the left side, I can do my lateral and my central. And then on the right, I'm only going to do my central. Okay. So now I have my holes punched. I would lubricate my sheet if I feel that I need to. And then I am going to go ahead and place my holes over my central incisors. So again, for you guys, your time would start. And I'm going to stretch the hole over the first lateral. And I usually try to do one at a time, so then that way I'm not trying to stretch too much. And then I'm going to find my other hole here. Okay, so now I have my Bugs Bunny teeth. And I'm going to put my patient napkin on so that I have this up off the patient, and it's going to be easier for me to manipulate. Okay, pull it down so it's not on his nose. Get my frame, and again I'm going to pull it tight so that it grabs those prongs. Okay, so now my dental dam frame is on. So now what I'm going to do is I'm going to do the right side first. I'm going to pull over the canine, and I'm going to pull over that first premolar, and then I have it down. Now normally I would put my wedge cord, right? But instead I'm going to put a clamp. So I'm going to get my clamp and my forceps. When you're using the clamp, the little 2 notches are going to go into the holes, and you always want the bow up. Okay, so this bow is going to go opposite this hump over here, and then I just kind of pull it tight to open it a little bit. I don't want to pull it too wide or it's going to stretch out the clamp, but just enough to go over the teeth. Okay, the bow is always going to go towards the posterior part of the mouth, because if I put this on this way, it's going to be in my way if I'm working on these anterior teeth. So I need it to go, the bow is going to go towards the posterior. I'm going to slide this on over the first premolar. Okay, when I do this, you'll see that it sits right in the palm of my hand so that I can hold it. Okay, and when I place it, I'm going to go down on the lingual side first and then pull it over the height of contour of the tooth onto the buccal. Okay, so you'll see I'm going to go on the lingual down to the gingiva and then over the buccal, place it down at the gingival margin, and when I do that, I can slide this little lever off and it comes right off. Okay, but the important thing is always to go from the lingual and then over the buccal, because if you remember your anatomy, you're probably just learning this in anatomy, but there's a height of contour. The lingual is usually smoother, and then the buccal part usually has like a lump on the buccal portion. It's wider on that side. So it's easier if you go from the lingual and then come over that hump to the buccal. Okay, so that's one side. So now I'm going to pull these teeth over, and sometimes the holes get stuck in between the teeth. So you really got to make sure that you pull over correctly. And I see there's my lateral is kind of down in between the teeth, so I'm going to pull that up. So I pull that one over my lateral. Then I got my canine, and then I got my first premolar. Okay, and you notice I'm just mainly using these 2 fingers to manipulate the material. Then I'm going to get my next clamp. And again, I'm going to put the little projections in the holes, open it up, lock it into place, well, if it will. Then I got it in my palm, I'm going to go from the lingual, sit it down on the gingival, over the buccal, and place it down. Okay? And now it's on. And so now I'll just move this little floss over this way, and so now it's in place and the doctor can work on the tooth. Okay? And remember, before, sorry, I shouldn't have said that. We still have some more work to do. We need to floss down our interproximals. Okay. Got ahead of myself. This is all the same. The only thing that was different was putting those clamps on. Okay.
So what would you be doing to move the clamps?
The clamps just hold, it's just more stability, just to hold the dental dam. Okay. So I floss my interproximals to get the dental dam down. Remember, I would dry, and then I would use my plastic filling instrument to make sure all my turtlenecks are down and around the teeth, which they are. And then I'm going to go in a lingual. Sometimes the lingual's up a little bit, so I make sure I push these down. And they're down. Okay, and then I'm going to check, make sure there's no holes, no tears, and we are perfect.